Insulin resistance is a condition in which the body's cells become less responsive to the effects of insulin, a hormone produced by the pancreas. Insulin plays a crucial role in regulating blood sugar levels by allowing glucose to enter the cells and be used for energy. However, when you have insulin resistance, your cells do not respond effectively to insulin, causing higher levels of glucose to remain in the bloodstream. Insulin resistance can occur for various reasons, including genetic predisposition, obesity, sedentary lifestyle, and poor dietary choices. When your body becomes resistant to insulin, the pancreas compensates by producing more insulin to try to keep blood sugar levels in check. This leads to chronically elevated insulin levels, a condition known as hyperinsulinemia. Causes and risk factors of insulin resistance. Insulin resistance can develop due to a combination of genetic, lifestyle, and environmental factors. Some individuals may have a genetic predisposition to insulin resistance, making them more susceptible to developing the condition. However, certain lifestyle choices can also contribute to the development of insulin resistance. Obesity and excess body fat, especially around the abdomen, are significant risk factors for insulin resistance. Adipose tissue, or fat cells, release substances called adipokines that can interfere with insulin signaling in the body. Additionally, a sedentary lifestyle and lack of physical activity can contribute to insulin resistance by reducing the body's sensitivity to insulin. Certain medical conditions, such as polycystic ovary syndrome, PCOS, and non-alcoholic fatty liver disease, are also associated with insulin resistance. Hormonal imbalances and liver dysfunction can disrupt insulin signaling and contribute to the development of insulin resistance. Symptoms and diagnosis of insulin resistance. Insulin resistance often develops gradually, and many individuals may not experience noticeable symptoms in the early stages. However, as the condition progresses, symptoms may become more apparent. Some common symptoms of insulin resistance include 1. Weight gain, particularly around the abdomen. 2. Difficulty losing weight, despite efforts to diet and exercise. 3. Fatigue and low energy levels. 4. Increased hunger and cravings for sugary or high carbohydrate foods. 5. Frequent urination. 6. Skin discolorations, such as dark patches on the neck or in skin folds, acanthosis nigricans. Diagnosing insulin resistance usually involves a combination of medical history, physical examination, and blood tests. A healthcare provider may review your symptoms, family history, and lifestyle factors to assess your risk of insulin resistance. Blood tests, such as fasting glucose and insulin levels, may be performed to evaluate your body's response to insulin. Complications associated with insulin resistance. If left untreated, insulin resistance can lead to various complications that can significantly impact your health. One of the most significant risks associated with insulin resistance is the development of type 2 diabetes. Over time, the pancreas may struggle to produce enough insulin to compensate for the body's resistance, resulting in high blood sugar levels and the onset of diabetes. Insulin resistance is also closely linked to an increased risk of cardiovascular disease. Elevated insulin levels can contribute to the development of high blood pressure, high cholesterol levels, and inflammation, all of which are risk factors for heart disease and stroke. Furthermore, insulin resistance has been associated with an increased risk of certain types of cancer, including breast, colon, and pancreatic cancer. The exact mechanisms linking insulin resistance and cancer are still being studied, but it is believed that elevated insulin levels and chronic inflammation play a role in promoting cancer growth.